Well, in many ways, the coronavirus is changing how this flu season could pan out. Doctors say things look good now, but could take a turn for the worse if people don't get vaccinated. Here's News 3 reporter Kofa Lasaki.
Some good news this flu season. It could be milder than years past.
Maybe for the same reason we were doing all the social distancing, all the non-pharmaceutical interventions that we were doing for COVID, which for another respiratory virus like influenza is probably also helpful.
That means all the mask wearing and hand washing because of coronavirus is also helping prevent the spread of influenza. But doctors caution the best course of action is still getting the vaccine.
We do recommend is that people start vaccinating around the 1st of October, but same for everyone else. I mean, the recommendation is certainly everybody from 6 months of age on up. And the very young and the very old are most at risk for influenza.
The peak of flu season is often from January to February, but doctors are urging people to get the vaccine now. They fear an influx of flu patients mixed with COVID-19 patients will burden an already strained healthcare system if people choose not to vaccinate.
It's encouraging, I think, that it was a relatively light flu season. But it's also, they say, because people in Australia and places like that were also getting their influenza vaccination.
A common misconception is that the vaccine can give you the flu, but that won't happen because it doesn't contain a live virus. Doctors continue to warn that the common symptoms of COVID-19 and the flu can be identical.
We don't want you going into a clinic with a waiting room, when you're potentially at the risk of spreading disease.
Which is why anyone with fever, cough, or shortness of breath is encouraged to be even more cautious this season and call their physician first instead of risking the spread of either virus. Kofa Lasaki, News 3.